STIs is not something that is supposed to be, shameful. There's no shame, there's no judgment here. We're
Yeah.
just here to give you facts, and the facts is this is something that is common, but it's something that you can manage. There's something that you can prevent. It's something that you can treat.
I would say almost everyone who's sexually active will get it at some point. Condoms can reduce like the risk of sexual transmitted diseases, but they don't eliminate it completely, especially. Welcome to Consultation Room Podcast. Today, we are going to be talking about something that affects millions of people, but still isn't talked about enough. This is sexually transmitted infection, STIs, or sexually transmitted disease. We're diving into the myths, the facts, and what you need to do to stay informed, safe, and stigma-free. So let's start off with the basics. What are STIs, Trudy?
Okay, so STIs are basically, these are three very little words that come with a varied range of stigma. And as you said, Stephanie, there are sexually transmitted infections, or we also like to call them sexually transmitted diseases. And these are infections or diseases that can spread through sexual contact. That's including the vagina, the anus, or even oral sex. They are caused by bacteria. They're also caused by some viruses, and sometimes some parasites can cause some of the common STIs.
Yes.
And basically, this will affect some of the areas that you're likely to get the infection, which is sort of the genital area, or maybe the mouth, or even other parts of the body.
Yes.
Now, the good news is they can be treated and they can be cured, but we'll get into that. So some of the most common ones that we'll probably talk about today are chlamydia, gonorrhea. We'll also talk about syphilis, and we'll also just touch very briefly on HIV and HPV, and maybe just mention the very sort of like common one, which is hepatitis B and hepatitis C. But we will just very briefly talk about STIs in general, just for you to have an idea.
Yes.
So starting with chlamydia and gonorrhea, Steph, what exactly are we talking about here?
Okay. So chlamydia and gonorrhea, these are bacterial infections and they are very common in young people. So when it comes to chlamydia, it affects up to 70% of women and 50% of men. And most people don't actually notice anything unusual when they have chlamydia, actually. And if left untreated, although sometimes you may notice you have it, it can actually lead to a lot of complications. But luckily enough, there is a treatment for it and it can be treated with antibiotics. But as I said, it is a bacterial infection and that it's usually spread by, as Trudy said, through vaginal or anus or oral sex. Yeah. Do you mind going through the symptoms with us when it comes to chlamydia?
No, of course not. So when it comes to chlamydia and gonorrhea, they kind of tend to share the symptoms. So it's almost confusing to know exactly what could be going on by just looking at your symptoms. But some of the very common symptoms that you will experience with both of them, so for women, there is the unusual vaginal discharge. So when it comes to chlamydia, that discharge is probably going to be yellow or sort of like a milky white. We have mentioned discharge before, but what we said before is there is the common and the very normal discharge, and then there's the discharge that is outside of what is normal. So in the case of chlamydia, it might be sort of like yellow or like a milky white. You might also experience pain or burning during urination, and also maybe pain during sex. And also women might experience bleeding between periods or even after sex. This is a sign that you could be having chlamydia. And also sometimes if you have maybe lower abdomen pain or pelvic pain, this could be associated with chlamydia. Whereas for men, when it comes to chlamydia, they might experience discharge from the penis as well, which could actually be clear or it could be cloudy. And also, some men do experience a burning sensation whilst they're urinating. So this could be an indication that you might have chlamydia. And another symptom that is quite common with chlamydia is testicular pain or swelling. So if you notice that your testicles are maybe a little bit swollen, a little bit swollen than usual, or they're painful, that could warrant just a doctor's check, just to make sure everything is okay. And if maybe you're having some of the other symptoms, it might be worth visiting a gum clinic just to make sure that you get some tests done. In some cases, some people also experience sore throat, especially if it's transmitted orally, or even eye infection if maybe they're exposed to chlamydia via touch. And some people might also experience rectal pain and discharge and bleeding via sort of the anus. These could be if maybe you've got it via anal sex. So this is common with chlamydia. With gonorrhea is pretty much the same. Now, the only thing that is different when it comes to, say, gonorrhea in women is you will get that your discharge is probably thin, watery, yellow, or greenish. This could indicate that maybe that is not chlamydia but gonorrhea. For men, you could also experience the very exact same symptoms as you did with chlamydia, but some of the symptoms that could kind of differentiate it from chlamydia would be that you might have white, yellow, or greenish discharge from your penis. So this could indicate that that is gonorrhea. So I think the next one we have on is something like syphilis.
Yes. So syphilis is actually caused by bacterium. So, and that usually progresses in stages and can cause serious health issues if left untreated. It's often called the great imitator because its symptoms can look like many other diseases when it comes to syphilis. But as I said, it is caused by bacteria, and it starts off painless, and it progresses over the years if left untreated. Do you want to go through the symptoms for that one?
Yes, of course. So with syphilis, there is normally 4 stages. So it can develop in 4 stages. As you mentioned, Steph, it is a great imitator. So you could go for years, as you said, without even having some of the common symptoms, and you might not even know that this is syphilis. So the very first stage of syphilis is the primary symptom stage, or they call it primary syphilis. And basically, this is normally between 3 to 6 weeks after infection. And what you might get is just painless sores. So you might get sores in the genitals, the mouth, maybe the anus, maybe the rectum, but they're painless. Just sores, you just see them there, no pain. What you might also get is maybe single or multiple sores, and they might, again, not be painful, but it doesn't mean that the infection is gone. The infection is still there. And then the second stage is the secondary syphilis. This is normally about weeks to months after infection. And this is when you start getting some of the common symptoms, which is sort of like a skin rash. And this might be mostly on the palms of the hand or the soles of the feet. You might also get flu-like symptoms, so sore throat, fatigue, muscle ache, the likes of that. Maybe even swollen lymph nodes, patchy hair loss. So if you're losing your hair, but in sort of patches, that could indicate that is syphilis. And you might also get sort of like white or grey wart-like sores. This might be in the mouth, in the anus, in the genitals. This is secondary syphilis. And then there is the latent syphilis, which is sort of like part of what you said, which is you might not notice anything during this stage where there's no visible symptoms, but the bacteria is still in the system, and it can last for years, and it can progress to the very last stage which is the tertiary stage of syphilis. And this can be sort of 10 to 30 years after infection. And this is where it gets a bit severe. So this can damage your organs. So you have like maybe like a severe heart damage,
Okay.
or severe brain damage, or liver damage, or even start getting like extremely painful joints. It might also mess up with your vision, so vision problems, memory loss, and of course it can be light threatening. So these are the very common symptoms when it comes to syphilis. Not to say that if you have other symptoms and you have been diagnosed with syphilis, that it doesn't apply. These are just some of the very common ones. What else have we got? We've got
So,
herpes,
yep.
genital herpes.
Yeah, we've got herpes. So this one's tricky because it's caused by two types of viruses, actually. So we have the HSV1 and the HSV2, and it's usually oral. So causing like cold sores like that most people experiences, but it can be transmitted to the genitals as well, through oral sex. Don't yes. Just remember that. And HSV2 typically causes genital herpes. There's no cure, but antiviral medications can manage it. So with herpes, we usually say that it is for life because it stays in the body, and it usually causes occasional outbreaks. And it can sometimes come upon when you're like stressed or immunocompromised. Yes.
Yeah.
So do you mind going through the symptoms for this one as well?
No, of course not.
Yes.
So some of the very common symptoms when it comes to genital herpes, again, just like syphilis, it kind of presents in different stages. So there's the very early symptoms, and this is sort of the first outbreak. And during this time, you might experience sort of tingling, itching, or burning in sort of the genital areas. And this is just before the sores appear. So if that is the case, it could be that maybe you're about to get herpes. And then you might also get flu-like symptoms, the body aches, swollen lymph nodes. This could be an indication of herpes, but this is mainly in the first outbreak. After which, there's the primary symptoms, and this is now when you start noticing more of the symptoms of herpes. So you might get like blisters and sores, which can be painful. So you might get painful blisters and sort of like ulcer-like sores in the genital area, in the anus, in the buttocks, or even the thighs. So if you experience some of these things, the blisters and the sores that are very painful, you might want to get tested for herpes, just to make sure that it's not, just to know exactly what it is.
Yes.
And then some people have recurrent outbreaks, and again, this is when there's repeated outbreak of herpes. Now, it's normally not as severe as the very first outbreak, but during this period, again, you might get just the sort of like blisters and ulcers, but as I said, it wouldn't be as bad as the very first outbreak. And even sort of the burning, the itching, the tingling might not be as bad as it was in the beginning. And some people actually go for years and months without getting any outbreak, and then it kind of like just it remains in your system. As you said, Stephanie, there's no really a treatment. Hopefully, there might be a treatment for it, because there's so many people who have, millions of people suffer with herpes. But at the moment, there isn't any treatment for herpes. And you might not necessarily have the symptoms, you might not get the outbreaks, but it might remain in your system for years. And you just have to manage it. You did mention that there is a treatment to manage the symptoms of it, which is the antivirals. But otherwise, just other ways would be like just soothing the very sore areas and things like that. But there isn't a treatment as such.
That's right.
Now we have HIV and HPV. Should we
Yes.
start with HPV?
We do HPV, yes. So
Mm-hmm.
HPV, known as human papilloma virus, this
Yeah.
one's super common actually. It almost, I would say, almost everyone who's sexually active will get it at some point. Yes, like most strains are actually harmless and they do
Mm-hmm.
go away on their own. So, but sometimes it can lead to like genital warts and, or more seriously, actually, it can lead to like cervical and other cancers.
Mm-hmm.
But there is a vaccine, so definitely look into that and make sure you're getting that vaccine for some prevention. Do you mind going through the symptoms for this one as well?
Oh, okay. Now, of
Yeah.
course. So when it comes to HPV, unfortunately, most cases have no symptoms. So there isn't anything you need to look out for to find out if you have HPV or not.
Mm.
The only sure way to find out if you have HPV is if you have this pap smear. So if you're getting your letters from NHS saying you need to come for your screen, you need to come for your pap smear
Yes.
screens, please go for this screening, because
Yep.
it will, honestly, it could be what saves your life, because as you said, Steph, there is complications when it comes
Yes.
to HPV. It can lead to further complications.
Yes.
So one of the main complications, especially in women, is something like pelvic cancer. So this is a way that can actually save your life. So pap
Mm.
smears are literally the only sure way of finding out if you have HPV, or even HPV testing. So there
Yes.
is no one symptom that will point to HPV. Now, HPV vaccine, as you said, Steph, does protect against the most dangerous strains. It might not necessarily
Yes.
protect against all the strains, but it will protect against the most dangerous strains. And what will happen is, if you have, tested for, you've done pap smears, and they've maybe found that you have some abnormal HPV cells, you just will probably get monitored. But if you start developing things like genital warts, they might need
Mm.
to just maybe do regular testing, a lot more tests, just to find out exactly what is going on with your organs and things like that. So that is probably the only symptom I would say to look out for. So if you have done your pap smear and they have said to you that you have abnormal cells, or they've said to you that you've tested your HPV positive, just look out for any sort of like genital warts. If you
Mm.
have this, go back to your doctors for them to do further tests. But when it comes to symptoms, unfortunately, there isn't one specific one that you should really be looking out for.
Yes. Yes.
Mm-hmm.
Brilliant. And
And yeah.
lastly, we've got the HIV. I
Yeah.
mean, we can't talk about STIs without talking about HIV. We'll briefly, like, literally just go into it. So
Yeah.
this is a virus that attacks like the immune system. It has been there for a while. There's no cure, as we all know, but there are treatments have come a long way. There are medications that help keep the virus at bay, and people can actually live long and healthy lives when they take the medication properly,
That's
and
it.
even prevent transmission whilst you're on this medication. Anything to add, Miss Trudy?
Of course. What
Yes.
I'm going to say to start with, before I even talk about some of the symptoms, maybe you can look out for if you want to test for HIV, is HIV is not a death sentence,
Mm.
full stop. And I say this because there is this stigma. When we said, when you talked about stigma to begin with, one of the most common stigma is with something like HIV. There is
Yes.
there's a very big stigma. It's very stigmatized, and
Yeah.
that is not really, there are no facts out there about
Mm.
HIV. So it is not a death sentence. You couldn't have said it better, Steph. There is a lot of treatment now to manage HIV. Unfortunately, there's not really a treatment to cure it, but it
Mm.
is manageable. Antiretrovirals have come a long way, and now people live happy, normal lives. Some
Yes.
of the things you can look out for when it comes to HIV is during the first stage, which is what they call the acute retroviral syndrome or primary HIV infection stage, is something like fever. So if you're constantly having fevers, or you have fatigue and body aches, maybe constant sore throat, night sweats, skin rash, headaches, these could be an indication that maybe something is not right with your immune system, and you might want to get checked for
Mm.
maybe HIV. Again, we're not saying that could be exactly it, but if it's a test that is, that is presented to you, don't feel offended. It's just because these are some of the symptoms of the first stage of HIV.
Yes.
And then after that, there's sort of the chronic HIV, which can actually be asymptomatic or very mild symptoms, and it can last for years. And I think the most important point mentioning here is, if you say have a new partner and then maybe you're having some of these symptoms, it's very important to get regular testing, because that's the only sure way of knowing if you have some of these STIs and HIV included. There is no other way sometimes to find out if you have some of these STIs, because some of them, you can be asymptomatic for years and years. But what you might get is with sort of like the chronic HIV stage is recurrent infections. You
Mm.
might also get swollen lymph nodes and maybe just, fatigue as well.
Yes.
And then it's when it leads to AIDS, then things can be quite serious, because you get rapid weight loss, and then maybe chronic diarrhea, chronic fatigue, frequent infections, persistent fever. So nothing is bringing this fever down. Skin rashes, and I'm talking about all over the skin, and even memory loss. This is now
Mm.
when things have got a bit past the stage of, okay, we just need to treat this, we need
Yeah.
to manage this, very simply. Now you might be getting, a lot more things to manage your HIV/AIDS. But
Yes.
as we said, HIV is manageable. It is not a death sentence.
Mm.
Yeah.
Yeah.
Is it worth
Fantastic.
us just talking about sort of like Hep B and Hep C? The reason I say this is, I don't know about you, Steph, but when I
Mm.
started working as a pharmacist, so during my pre-reg year, I actually had my my Hep B vaccine,
Yep.
only because if you're working in healthcare, I think it's one of the things you really should have. You
Yeah.
should have this vaccine just to prevent you from some of these things. And
Yeah.
maybe we can just quickly mention how and why that is the case. But should we
Yep.
just quickly mention them?
Yeah, yeah. So Hep B, as Trudy, hepatitis B, as Trudy mentioned, it's an infection that usually affects like the liver, and it's caused by the hepatitis B virus, and it can be transmitted through semen and body fluids like blood as well, and saliva, and through the vaginal fluids as well. It can be passed on from mother to baby, actually, for those that don't know. So it is quite important that there is a vaccine, as Trudy mentioned. There is a vaccine there that can help us be protected. So if you can, please get the vaccine, just to prevent you from getting this infection. Yeah.
Yeah,
Yeah. I think you could go through the symptoms as well for that one.
yeah. So, I mean, when it comes to Hep B and Hep C, both of them have got very, very similar symptoms, and they are almost very similar. There's only very few things to differentiate between the two. Some of the most common symptoms when it comes to both Hep B and Hep C is fatigue. So if you experience, extreme fatigue, loss of appetite, nausea and vomiting, maybe unexplained abdominal pain or abdominal discomfort, jaundice, that could actually be an indication of maybe you have Hep B or Hep
Mm.
C. A fever, a fever that is just not going down. Even joint pain. If you have extreme joint pain, that could be an indication of Hep B or Hep C.
Mm.
And when it comes to sort of like chronic Hep B, it can be asymptomatic for years, and it can lead, as you said, Steph, to liver damage, liver cancer, or other complications. I think the only way to differentiate the two is Hep B. As you said, Steph, it can be passed from mother to baby.
Mm.
That's not the case with Hep C, and Hep C is mainly transmitted during sort of needle sharing. So people who use, especially drug users, if you're
Yeah.
constantly sharing needles, that could lead to Hep C.
Yeah.
But that is not the case with Hep B. Hep B is mainly transmitted via blood and sexual intercourse.
Mm.
I think that's one of the most, at least we've talked about some of the most common STIs, unless there's any that we've missed that we sort of like get queries about in pharmacy
Yeah.
stuff. But those are the most common ones. I think we can both
Yes.
agree that those are very common ones that we get
Yeah.
a lot of
Yeah.
questions in pharmacy about. Um, Now, shall we just talk about maybe preventative measures or how to prevent getting STIs? You want to take us through that?
Yeah, of course. As Trudy mentioned, STIs are usually transmitted through body fluids, through sexual intercourse. So it could go through the saliva, vaginal, um, fluids, through semen. So the best way to protect yourself and to protect others is basically use protection. So
Yeah,
protection, as in you can use condoms during sexual
yeah.
intercourse. You could also use dental dams, which can reduce the risk, especially if you're performing oral sex. Dental dams are
Hmm.
quite effective. Another way to prevent yourself from getting some of these STIs is get vaccinated for the ones that are available for, which we've already mentioned.
Hmm.
So
Yeah.
the HPV, the hepatitis B vaccines. So they offer very strong protection. So these are like the main ways of preventing yourself from getting these infections. But most importantly, do get tested regularly. So if you're someone who's sexually active, especially with new or multiple partners, I think regular STI screening are essential, um, because as we mentioned, there are some of the STIs which are asymptomatic, so you won't
Hmm.
necessarily have you won't have some of the symptoms, or you won't even notice that you have this STI going on. So the best way to help yourself is just get tested. So once you get tested, you'll be able to find out whether you're infected or not. And if you are, you can inform your partner or partners. And
Yeah.
I think, lastly, for me, a key thing that helps prevent STIs is to communicate effectively with your partners. I feel because there's like a stigma around these diseases, people shy away from talking, like having an open conversation. So have an open
Hmm.
conversation with your partner, or even if it's a new partner or even your regular partner, just ask them, like, who have you been with?
Yeah.
Those sort of things, like talk about STI, talk about getting tested before getting into a relationship, because you need to
Yeah.
know someone's STI status, and so that you can help yourself and protect yourself. And that's the only way really we can go around reducing this risk and stigma around STIs.
Yeah.
So these are the main ways of
Mm.
getting, yeah, of getting protected. Another way is because we mentioned that some of these STIs are passed through like blood or bodily fluids. If you do share, let's say, needle with someone, please stop that. If let's say for instance you get tattoos or any body piercing, make sure that these are sterilized, they're not used by anyone else, because
Hmm.
if the blood is contaminated and someone has an STI, if you use that needle, chances are you will be infected. So please make sure that you do not share needles. Okay, that
Yeah.
is number one thing to um stop yourself from getting an STI. Um, yeah, so if you're active, sexually active, make sure you get regular tests. Is there
Yeah.
any other ways people can prevent
I think you've
from?
mentioned pretty much all the ways that there is available for people
Yeah.
to prevent themselves. The most important thing is whenever you're getting into, say, a new relationship, just be open about this
Mm,
conversation where you both maybe get tested before getting, getting sexually active, becoming sexually active,
yeah.
because that is the only way that you will know that you're both coming in, you know exactly what is going on. Basically, you will
Mm,
know the status of each other's sort of health before you interact like that. So the most important thing, honestly, is having that open and honest conversation
yeah.
before anything. I think there's no other way to prevent yourself from getting
Yeah.
some of these things than that, or at least to prevent the spread of some of these things. Because
Yes.
then you will know when you need maybe to have extra protection, or where you need to do, maybe you need to do XYZ. So I think just
Yeah.
being very open and honest about this conversation, and let's just literally just put this stigma when it comes to STI aside.
Mm,
STIs is not something that is supposed to be, shameful. There's no
mm,
shame, there's no judgment here. We're
yeah.
just here to give you facts, and the facts is this is something that is common, but it's
Mm,
something that you can manage. There's something that you can prevent. It's something that you can treat. So no, I could not add any better to how
yeah.
to go about sort of protecting yourself.
Yeah.
But
Yeah.
we all know that there's always myths when it comes to STIs. And
Mm.
I know, Steph, you always have good myths. So give it to
Yeah.
us. What have you heard or
Yeah.
read out there when it comes to STIs?
Yeah, so there's a lot of like misinformation like out there about STIs. I'll just name a few, just a couple, so that we
Mm-hmm.
can debunk them. So, one of them, which we've already mentioned, is you would know if you had an STI. Although
Mm-hmm.
we have mentioned some of the symptoms of like some of the common ones, not all STIs that we mentioned have like symptoms. There are some
Yeah.
where it may not have any symptoms, but that's why we did mention regular testing is essential. So that is the only way you would know for sure if you have an STI, is to get yourself
Yeah.
tested. Yeah. The next I also had is condoms protect against all STIs.
Mm-hmm.
Yes. For this one, yes, condoms can reduce like the risk of getting sexual transmitted diseases, but they don't eliminate it completely, especially for STIs that spread through like skin contact, like the herpes or the HPV that we mentioned. So although yes, we have said that condoms are number one, like for protection, they don't
Mm-hmm.
eliminate all of the STIs. Yes.
Yeah.
So,
And bearing in mind, condoms are not 100% effective. So there is
yes,
always that. And if there's
exactly.
there's breaking of the condoms,
Mm,
then already the
exactly.
fluid has gone where it shouldn't. So the
Exactly.
condoms are never 100% effective. So
Mm,
that is definitely a myth.
exactly.
Hmm.
And the other one that I have here is you will get STIs only once, like in your life. No.
Oh,
No.
no.
There are some such as like what Trina mentioned, like the gonorrhea and chlamydia, which can reoccur even after treating it. So just
Hmm.
because you had it once does not mean that like you won't get it again.
Yeah.
Chances are you will if you are not protecting yourself. You will definitely get
Yeah.
that again. Yes.
Oh.
Any that you want to add?
Um, I think again, it's all about stigmatization when it comes to some of these
Mm,
sexually transmitted infections. So I just know, like growing up, there used to be this idea that when it comes to, say, someone with HIV or AIDS,
mm,
you will know them from a distance. Like when someone
mm,
is skinny, you're like, oh, they
mm.
have this. Just because you're maybe skinny or not not meaty or like not heavily built
Yeah,
doesn't necessarily mean you have an STI. So that
that's
is a
true.
stigma that when someone is looking maybe weak, maybe they look slender, that they could be having an STI. That
Mm.
is definitely a myth when it comes to
Yeah,
STIs. Otherwise, I think you've mentioned some of the ones maybe I would have heard, which is something like condoms will protect you from all
yeah.
STIs. And we all know that that is not true.
Mm-mm.
Yeah.
No, yeah. And I think lastly, I just wanted to add this. I think there was one that people said only people who have a lot of like partners get STIs. So people have that stigma that like, if like, for instance, you're sleeping with a lot of partners, that's when like you will get an STI. But even just
Yeah.
having one committed
But
sexually active partner, you can still get an STI. Like it only takes one
yeah.
partner. So
Yeah.
yes, just
To be
get
honest,
tested.
I'm glad you mentioned that because
Yeah.
there was something that went viral on TikTok, I think maybe a
Mm,
few years ago. There was this young girl, I think she was probably like 18, 19, and
mm.
she was very honest. And honestly, I respect her for her honesty and just how candid she was. But she was like basically saying how her first boyfriend, when she was, I think, 17 or 18, her first sexual partner, who was her boyfriend, gave her, I think, 3 different STIs, including herpes, which is, as we said, there's no really treatment for. There's just a way
Mm.
to manage it. And, exactly, that literally explains exactly your point, which is you don't need multiple partners, or you don't
Yeah.
have to have had multiple partners to get an STI.
Oh,
It could be
yeah.
just the one partner who transmitted it. So the most important point is have these conversations, have these
Yeah.
honest and open conversations before you get into anything, because
Yeah.
you never know what is going on with the other person. Just because you have checked yourself doesn't mean that they have, or
Yeah.
they're honest about it. So honesty is key here.
Yes. Yes. Brilliant. Brilliant.
And I think it's worth adding that when it comes to, say, pharmacy, if you have come in with some sign symptoms, now there is certain tests that you can actually get from pharmacy.
Mm.
So literally, actually, I think the test for all the things we've talked about, so chlamydia, gonorrhea, HIV, herpes, Hep B, Hep C, and syphilis, you can actually get a test for these things. And I
Yeah.
think you get them maybe sent to you, or you can buy them in most of the pharmacies now, and then you just send it off and they'll just do what they need to. And most of them have like maybe a blood test sample bottle. You just take a very small sample of your blood, maybe
Yeah.
swabs for both the anus and the vagina, and then you can send them off and get the tests back. So I think it is very, very important. And maybe if even if it's a partner you're a partner you've been with for a while, if there's any issues and there's maybe some trust issues, it's worth, let's be honest, it's worth maybe getting some of this tests, and just to make
Yeah.
sure that what your status is. So these are tests that is available in pharmacy that you can buy, and then you can send it off, and at least that way you'll get your results and know exactly what is going on.
Yes. 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 Brilliant.
So when it comes to STI, Steph, what
Mm.
is the take-home message today?
Okay. For me, I would say STIs, as we've mentioned, they are so common. As you can see, they are treatable and nothing to be ashamed of. But one thing I just wanted to add on before going on to like my message is, if you think you may have an STI, please go to a sexual health clinic so that you can be
Mm-hmm.
treated. Even
Mm-hmm.
if a sexual partner has symptoms of an STI and you
Mm-hmm.
don't, please go to the sexual health clinic. If you're
Yeah.
worried after having sex without a condom, please go to the sexual health clinic. Um,
Mm-hmm.
if you're having like casual sex without a condom with new partners, that also warrants you to go to the sexual health clinic. And
Yeah.
and I think if you're pregnant as well and you have symptoms of any STI, please go straight to sexual health clinic. Do not have sex, including oral sex, without using a condom until you have had a check or you've been tested. Okay?
Mhm.
So that's one thing I wanted to put out there. But my take home message, as I said, STIs are very common and they're treatable, and we shouldn't be ashamed of it, you know. We
Mhm.
have gone through the symptoms of the common ones. So please educate yourself about these
Yeah.
symptoms so that if you are experiencing them, you would know what to do and you would act really fast. But there are some, as we mentioned, that do not have any symptoms as well. So
Yeah.
regular testing is essential. It is key for you to get regular testing, especially if you are sexually active.
Yeah.
Prevention through protection, vaccination, and open conversations goes a long way. Please do not shy away from these conversations with your partner. Make sure that
That's
you
it.
have open and candid conversations
Honest.
with them because
Yeah.
it will save you in the long run. And the more we
Exactly.
talk about STIs, the easier
Mm-hmm.
it is to stay informed and
Yeah.
break the stigma. Um, what is your take-home message, Trudy?
Okay. So when it comes to STIs, routine STI testing is literally the best way to detect and to treat STIs. So if nothing else, just have that routine STI testing,
Mm,
because we know and we've said it, what we've said is if left untreated, it can actually lead to complications
mm-hmm,
like, things in women, pelvic inflammatory diseases in women, even as we've said, cancer, and even infertility in both men and women.
mm-hmm,
So even if not for yourself, maybe for your partner, get that routine STI testing. I can't emphasize on that enough. Because honestly, if you are sexually active, you should have regular screening, and safe sex practices are honestly the key thing to preventing STIs
mm,
transmission and STI infections. Because what people don't realize is, and especially with some of the STIs that we've talked about, we've said there is treatment, there is drug resistant strains which are on a rise. So protecting yourself is the best way, and
mm,
getting that screening maybe every year. That is the best way to just make sure that your nurse, your health status, what your sexual health is like, if you're healthy, and
mm,
if you need to maybe get treatment from maybe GAMP clinics, maybe your GPs, maybe your pharmacy. And these places should not also, there's a stigma around these places. If
mm,
I would say someone sees you going to like a GAMP clinic, or going to like the young people service, or ringing, say, the National Sexual Health Helpline, it's like, oh, you have this, you have that. No, prevention is always better than cure. And if this is what helps prevent you from having STIs, from contacting STIs, by all means do that. And honestly, share this with your friends, the people you know. This should be information that should be free to everyone, but it should also be a conversation that we're open and honest about.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.